Hi, everyone. My name is Cydney Murray, and my pronouns are she, her. I'm a second-year student at Temple University's Beasley School of Law, and I've been an intern at Temple University's Center for Public Health Law Research since June 2020. I'm joined here today by Adrienne Ghorashi, Esquire, pronouns she, her. Adrienne is a program manager at Temple University Law School's Center for Public Health Law Research, where she manages multidisciplinary grant-funded projects, tracking and evaluating the effects of laws on public health. Her work primarily focuses on the health impacts of legal barriers to abortion. She also currently serves on the boards of Women's Medical Fund and the Philadelphia chapter ACLU, and as a governing counselor for APHA's Sexual and Reproductive Health section. We are here today because of National Public Health Week, which is an opportunity to celebrate and reflect on the field of public health. And Tuesday, April 6th has been designated Advancing Racial Equity Day. In honor of this, Adrienne and I will discuss the Center's abortion law database and how this work is critical to advancing racial and economic justice. So Adrienne, how does the regulation of abortion fit into advancing racial equity?
Sure. So reproductive freedom, which encompasses the ability to make personal choices about your own family and access to care that you need, is crucially important to achieving racial and social equity. The inability to access abortion is both a symptom of racialized poverty and deepens existing health and socioeconomic disparities. So the ripple effects of having to fundraise for your abortion out of pocket, visit multiple clinics, navigate childcare and time off from work all have a tangible impact on the pregnant individual and their families. Additionally, delays in seeking this care can add to the financial costs of the procedure, and this can trap you in sort of this vicious cycle of poverty. So if you care about racial and gender disparities in health, you should absolutely care about abortion access.
Very important work. So what exactly is the state abortion laws database, and how can it help researchers better understand the impact of abortion laws?
Sure. So the database is a tool for researchers, practitioners, advocates, policymakers to explore state laws on abortion. And we cover 15 different topics, things like gestational bans, mandatory waiting periods, parental involvement laws, and insurance restrictions. And all of this legal data is publicly available for download and can provide us the basis for evaluating outcomes related to health and other disparities. So understanding the nuances and distribution of restrictive abortion laws and case law using this data can help us to better understand what the effects of laws are and how those sort of contribute to racial and economic disparities.
Absolutely. So with the Biden administration now in office and Justice Amy Coney Barrett confirmed to the Supreme Court, do you expect certain changes to the abortion legal landscape?
Well, what I would hope to see from this new administration is tackling some of these federal policies that do restrict abortion access, particularly repealing the Hyde Amendment and removing that from the budget, which limits Medicaid coverage for abortion, as well as lifting the FDA restrictions on medication abortion. And removing these policies would have a significant impact on increasing access for individuals, and particularly for Black and Brown communities. In terms of the Supreme Court, I think that given the changes, we may see the limits of Roe v. Wade being tested or chipped away at through states sort of passing and litigating unconstitutional abortion laws, such as fetal heartbeat bans and outright bans on all or most abortions, to sort of force the issue before the courts. And so Cydney, as one of our superstar interns at the center, why don't you tell us a little bit about what you've been working on?
Absolutely. So mandatory counseling and waiting periods are two examples of restrictive abortion regulations that states have increasingly imposed. And these restrictions create financial and logistical hurdles, which burden marginalized groups of pregnant people especially. We have been working together with Dr. Tiffany Green at the University of Wisconsin to build a longitudinal database of these laws, using policy surveillance methods to collect and analyze them. We plan to integrate this database with data on abortion rates and pregnancy-related health and birth outcomes to examine the impacts of these laws on maternal and fetal health outcomes, and also to evaluate whether these laws produce different outcomes by race and ethnicity.
You've been doing such a great job with that project. Why is this project important to better understanding these racial disparities?
So racial justice and reproductive justice are inextricably related, and this project will provide tangible evidence of that. While issues of race, abortion access, and socioeconomic status appear separate and distinct on their faces, this project will help the public to better understand how all of these different areas are actually intersecting. So hopefully this information and this data will encourage us to take greater strides in increasing abortion access, and by doing so, also advance racial equity. So if you, our lovely viewers, are interested in accessing the abortion laws data, you can visit the center's website for policy surveillance resources at lawatlas.org. Again, that's lawatlas.org. Thanks for listening.
Thank you for joining us.